little brief background on parvoviruses. They're small DNA viruses. By themselves, they can't replicate in a cell, and so they need to pirate a cell and redirect its genetics so it can replicate and produce more parvoviruses. And they will only do this in actively dividing cells. So you want cells in the growth phase of their cycle, and so the diseases you get with parvovirus are a replication of what tissues it replicates in. We started looking at porcine parvovirus 2, probably got to be 5-6 years ago. There's a paper out from Dr. Helber and Tanya Pressing that talked about how common parvovirus was in the U.S. They didn't, parvovirus 2, excuse me. They didn't make any comments on what this thought about as a cause of disease or what, but parvovirus, different parvovirus struck my interest. Parvoviruses have a long family history of being important, and with that type of history and something that's apparently common, I thought it worthwhile that we looked into this further. And so primary interest was its role in reproductive disease or loss of pregnancy. And there's only one paper that I've ever been able to find, and this is it, that talks about parvovirus 2 as a cause of abortion. And in this particular study, they vaccinated pigs with parvovirus 1, challenged them with parvovirus 2. It protected against abortion, but it did not protect against infection and virus shedding. And so, again, our early indication or interest was looking at parvovirus as a cause of abortions, mummifications, pregnancy loss. And I said we wanted to look at Parvo 2, and so we already had a Parvo 1 PCR, so we combined the two so it would be less expensive to do routine screening. And as part of our test validation, we'll just start looking at tissues, no matter what their history is, just start coming through and look at the tissue results, look at the PCR results, look at the tissue results, and just see what's going on with that particular virus in the pig populations that we look at. And so started finding parvovirus 2 quite commonly in tissues with that had vascular lesions, and that always with me rings an immediate bell, is that endothelium is such a primary and intimate component of any immune response, inflammatory response, that anything that replicates in endothelium really said, kind of lights a bell on. It says, this is important, and also with prior knowledge also that parvovirus 1 you can also find replicated in endothelial cells. And so we looked at a lot of tissues over a year. We found a wide range of PCR positives in tissues, lung, joint tissues, lymph nodes, a lot of variation, a lot of different tissues. And so really wanted to demonstrate if virus is or where it is replicating in those tissues. And fortunately, Dr. Vanuzzi and Lacey, who's right here, have been working on a in-situ-hybridization technique for lots of different things, and so we're able to identify nucleic targets of parvovirus in tissues, and your target did indicate was specific for replication, right? Yes, okay. And so the target is for genetic targets indicate virus replication is happening in those cells, and not just sitting there doing nothing. So I've got a couple cases, a little constrained for time on to go through all of these, so I might go through them little fast. Cough, swollen joints, fallouts, acute mortality, it's like 80% of the cases we get in with that history. So we went through all the diagnostics on these cases. Find strep suis, Haemophilus parasus, Mycoplasma hyalinus. We get a arthritis back, lymphocytic and acute with Parvovirus 2 at a 14 CT, which was pretty low CT value, lots of virus activity going on there. Mycoplasma hyalinus, lymphoid depletion, histiocytic inflammation around there, North American PRSV, PPV2 positive, no circovirus in those, and finding a lot of bacterial inflammation as well as, let's say, PERS and Parvo2. And part of the reason I like to look for viruses is that with these cases, always want to look for initiators of disease, kind of break things down as initiators of disease and promoters of disease. Initiators make things go bad. The promoters just kind of pile on afterwards. And so when I think about initiators, most of the time I'm thinking about a virus infection. Like to hunt for viruses. And so we're finding, I said, PERS, parvovirus, and lots of bacteria. We also had serum for that group, and so we had positive PCRs for PERS and PCV3 we did find in serum in there. And this is a picture of, is this my pointer? No. There we go. So this is a picture of joint tissue. This would be the joint lumen. These are the joint cells, what's kind of left of them, lining the surface of the joint. And this is supporting tissue for the primary joint tissue. The inflammatory process is mononuclear, predominantly lymphocytic and plasmacytic, lymphocytes and plasma cells, which are very typical of a virus infection. And so the red staining here is, here's a nice little blood vessel right here. This is PPV2 replicating in joint tissue. And again, to me, you find a virus replicating in endothelium that indicates joint damage, vascular damage, increased accessibility then of bacteria into those tissues. So again, endothelium also a last line of defense against entry into tissues, and if you insult that, it's a lot easier for bacteria to get into where it shouldn't be. Same same case, different area, and lots of Parvovirus 2 replication going on in that joint tissue. Look at some lymph nodes. Lymph node, germinal center. And if you stain it for Parvovirus 2, germinal centers are in the area of active lymphocyte replication and education. And so it fits very well with what Parvo 2 likes to do, and that's replicate in cells that are very actively dividing. So a nice staining with Parvovirus 2 in this lymph node. Just a higher magnification, pretty easy to read. If you look at Pyrus patches, these are the lymphoid tissue in the small intestine, the end of the small intestine. And again, really straightforward positive results in there. So virus replicating in multiple tissues, something like parvovirus that gets into the bloodstream will have access everywhere. And so not unexpected or odd finding for parvovirus. And it's germinal center and some weaker signal turning up there. And really strong signal here. With pathologists, we like colored pictures. What can I say? So another history fallout, CNS disease in nursery pigs. And this was Interesting case, a prolonged recurring problem with strep suis mortality going on in the herd. They had endemic PRRS, and they just keep getting hammered at weaning with strep suis, sudden deaths, chronic streps, just lots of things going on in those pigs, lots of bacterial inflammation happening in those pigs. They've got some really significant rotavirus CTs here, go along, diarrhea, just pigs are getting challenged with lots of bacteria. And we are finding parvovirus 2. Looks kind of weak out of a joint, but we don't test lots of tissue in there, so to me it's apparent, at least it's there. And I see that as significant coming from a spot that should be sterile. They have structural problems in their ribs, so not only a infectious process, but there's a nutritional process here. And one thing we noted in these pigs, in the bone marrow, there was changes in the myeloid and erythroid series precursors as far as what's showing up in the pigs. They have some evidence of anemia. And in this particular bone marrow, we had parvovirus 2 at a 35 CT. And just keep looking at more of the pigs. We still, we're finding more parvovirus. We get down to this pig. Looking at bone marrow, we're finding PCV3, finding PPV2 at 30, buffy coat, not unexpected. And we finally get to the magic pig here, number 3, that helped explain lots of things to me. We look at the bone marrow of that pig, PPV2 at 15 CTs. It's a really low CT value, lots of replication going on there. Again, mitotically very active cells in the bone marrow, so it makes a nice population or fit with parvovirus 2. There's a leukopenia also in this pig, supported by white blood cell counts that you don't see right here. And then also looking then, trying to identify more specifically if we have evidence in white blood cells. And again, they had a really low PPV2 CT value. So again, myeloid, erythroid depletion. These cells were also pale and anemic at times, and a really pronounced replication of parvovirus 2 in bone marrow. And again, just progressing through all the different things in these pigs. Again, parvovirus 2 and rib problems and some more bone marrow issues. And so, as I think about these, so we see parvovirus 2 as being a really significant issue, or a significant issue in pigs, just beyond what may be happening reproductively. And so kind of the comment we'll get sometimes is, well, these are just diagnostic samples. They're not real academic experimental infections, and that's true. And so these are what you'd call uncontrolled observations. They're viewing things just as they are, just how they happen, and as opposed to controlled observations, which you see in an experimental setting. From experience, we know it's hard to reproduce experimentally a lot of the things we see in the field, and so I really try to concentrate or focus more on trying to understand the samples, the diseases that come in as they come in, and I think it's a lot more value for us to understand all the different things, trying to put the puzzle together on all the different variables that are going into pig diseases. And as I said, we've got lots of puzzles to solve. Parvovirus was, bad family history for causing disease. It was common. We find it in bad places where we don't want it to be. And so, to me, it kind of hits the nail on the head for important things that we should be looking for and trying to understand further.